Well, Trump's nomination of Robert F. Kennedy Jr. to be Health and Human Services Secretary is causing some controversy, especially when it comes to his views on fluoride in drinking water. The CDC supports adding fluoride to the water supplies because evidence shows that it reduces dental disease. RFK Jr. believes otherwise, saying that it can cause damage to the brains and bones of children. Now, we asked environmental impact reporter Scott Broom to help us better understand this debate and its impact on our water systems. Take a look.
In Virginia and Maryland, more than 90% of the public water supply has fluoride added. In the District of Columbia, it's 100%.
In my heart.
If confirmed as Secretary of Health and Human Services, Robert F. Kennedy Jr. aims to change that. Quote, the Trump White House will advise all U.S. water systems to remove fluoride from public water, Kennedy posted on X November 2nd. Critics call Kennedy's tweet dangerous for public health, particularly for kids, because of fluoride's well-documented protection from tooth decay, which has a big impact on general health, according to numerous studies over the decades. This debate heated up before the election when fluoride opponents won a major victory in federal court. In a September ruling, Obama-appointed U.S. District Court Judge Edwin M. Chen ordered the EPA to develop regulations on fluoride after a study by the U.S. National Toxicology Program of the NIH found moderate confidence that fluoride could be associated with IQ impacts on kids. The study relied on research outside the U.S. in places like Iran and Mexico, where children are exposed to at least twice the level of fluoride that's recommended for U.S. public water supplies. A competing 2023 analysis of U.S. studies found no relationship between the lower recommended level of fluoridation in the U.S. and IQ scores. Dr. Aaron Jankowski is Associate Dean at the Touro College of Dental Medicine in New York.
The unfortunate fact is that the studies that were used by the National Toxicology Program in the preparation of that report were actually from places outside of the United States where fluoride occurs naturally, when we say endemically, at very high levels, much higher than what we use for community water fluoridation programs. So really what's going on there is with those studies that they used, you're comparing apples to oranges.
But fluoride opponents call the judge's ruling in California a landmark. Stuart Cooper speaks for the Fluoride Action Network, which brought the lawsuit against the EPA.
And so this judge was able to look at that information, all of the research over 8 years, and hear expert testimony under oath, under penalty of perjury, and was able to determine that fluoride posed an unreasonable risk based on the hazard assessment guidelines the EPA was supposed to follow. But politics intervened in the EPA process. Politics did not intervene in the judge's ruling. And so
in the D.C. region, public water fluoridation policies remain the same, with all major public water suppliers continuing to add fluoride at the recommended level of 0.7 milligrams per liter. WSSC Water in Maryland issued a statement to WUSA 9. The utility has followed the recommendations of leading public health authorities since beginning the practice of water fluoridation over 60 years ago. Our approach to water fluoridation is based on years of research, science, and recommendations of leading public health authorities, the statement said. In Maryland, the Maryland Department of Health continues to support fluoride as a tool in reducing tooth decay, the department said in a written statement. The department noted fluoridation is a local decision and not mandated by the state. Health authorities in the district and Virginia did not respond to comment for this report. Scott Broom, WUSA 9.